Hello, my name is Mark Arneson. Over the next several minutes, I will be discussing the explanation of the value-based purchasing as well as the background of the all care measures. The learning objective of this video is to explain the following: core measures, all care measures, composite, the Deficit Reduction Act of 2005, and value-based incentive program. Let us begin. The Center of Medicare and Medicaid Services and the Joint Commission developed a process of care measures for acute myocardial infarction, congestive heart failure, community-acquired pneumonia, and surgical care improvements termed core measures. The term all care measure refers to a perfect care given to a patient for a specific disease. It is the percent of patients who receive all the needed core measures required for that disease state. The term composite refers to the percent compliance of all the possible opportunities, which is the total number of compliant opportunities for care divided by the total number of opportunities for care. The composite score will always be higher than that of the all care measures. The measures differ slightly between CMS and the Joint Commission and are reported publicly on their respective websites. The Deficit Reduction Act of 2005 directed CMS to develop a value-based incentive program to begin to align Medicare payments with the hospital quality performance. The Patient Care and Affordable Care Act put in place the mechanism and requirement for CMS to withhold a percentage of Medicare reimbursement and require hospitals to meet performance thresholds to earn back that withheld percentage. The amount CMS will withhold in fiscal year 2013 is 1% of the facility's CMS baseline diagnosis related group payment. This withhold will increase by 0.25% annually to 2% in fiscal year 2017. Based on the hospital's total performance scores, hospitals will have their DRG payments adjusted by the factor somewhere between a loss of the entire withhold to the gain of an equal amount to the withhold. The value-based program is budgeted neutral, resulting in many hospitals losing money and others gaining money. Hospitals must also continue to submit their scores to the hospital compared websites. The total scores during the first year of the value-based purchasing program will combine both clinical core measures and patient's experience measures, which are done through what is called HCAHPS. The clinical core measures domains consist of 12 core measures, which are both clinically relevant and not optimally provided across the country, and will reflect 70% of the total value-based score in the first year. The patient's experience domain consists of HCAHPS, patient's satisfaction measures, and their measures will reflect about 30% of the total value-based purchasing score. First year payment or penalties will be assessed in 2013 based on the hospital's performance during that time frame, beginning from July 2011 discharge and ending in 2012 of March discharges. Hospital will have two methods to gain points towards their total value-based purchasing scores. For each measure, a hospital can either achieve a certain level of performance or they can obtain points for improving their scores as compared to the baseline data. CMS will count the greater of the two scores, achievement versus improvement, and then CMS has also established national benchmarks and thresholds for each value-based quality measure. The benchmark represent the highest achievement levels, whereas the thresholds represent the minimum achievement levels. In conclusion, value-based purchasing incentive program is quickly approaching and can possibly be a financial disaster for some hospitals, while others it can make millions. Hospitals are already under a great deal of pressure, but now the value-based purchasing incentive program will put even more stress on an already stressful environment. Thank you.